Thanks very much, Mike. Yeah, so it's a pleasure to introduce Esther, who's a third year scholar doing research from racial inequalities in mental health help seeking among young people. And Esther's project is really cool because Esther's done a lot of work trying to work with peer researchers from young people from affected communities to design and deliver this project, which hopefully you'll be able to say a bit about, Esther, during your talk. Take it away. Thank you.
Thank you. Let's go.
Thank you. Sorry, just trying to get my screen sorted. Can everyone see my presentation? Yeah. Okay, cool. Hi, everyone. My name's Esther, and thank you, Jem, for the introduction, first of all. I'm currently in my third year of my PhD. As Gemma said, my research is focusing on the racial inequalities in mental health help seeking among young people. So first of all, why study racial inequalities in mental health help seeking, and why, as we'll go into, do I have a specific focus on Black young people? So as we already know, adolescence is a critical period for mental health when most issues first emerge, making early intervention vital. But we know little about how Black young people seek help or what prevents them from doing so, partly because national surveys underrepresent these groups. So like I said, why is this research important, and why am I focusing on Black young people? So Black children are 10 times more likely to be referred to CAMHS via social services rather than their GP, which highlights the systematic disparities. Research also shows that mental health service use is not equitable, with Black young people consistently reporting lower use, yet research in this area remains very limited. Black young people are more likely to anticipate negative experiences with mental health services, perceiving the system as unhelpful, racist, or untrustworthy. This can be seen as discouraging help seeking and underscores the urgency of understanding the factors that shape these disparities. So I'm going to quickly go over, I've got quite a bit to go through, so I'm trying not to focus on these bits for too long. But my research has three key objectives, and it takes a mixed methods participatory action research approach. So you can see my objectives on the screen. And number one, I'll be using reach data to estimate prevalence and inequalities in help seeking with a focus on Black young people. Number two, conducting interviews with Black young people to explore lived experiences. And three, the final component involves co-developing a school toolkit to reduce barriers to support. So like Gemma mentioned, I'm involving peer researchers throughout the entirety of this project. So the PAR approach is central to my project, and this just means working with Black young people, not just studying them. So involving peer researchers ensures that the research reflects their lived experiences and leads to more relevant, inclusive findings, especially when exploring issues like help seeking, mental health, and racism. So throughout this project, I've worked closely with 4 peer researchers, 3 girls, Tyra, Praise, and Funto, and 1 boy, Brian, and they've been integral at every stage, helping to develop interview guides, provide feedback, and also co-create. Finally, that'll be helping to co-create the toolkit, and also help interpret the findings. After every workshop with young people, I use anonymous feedback forms to evaluate collaboration and just ensure that all of their voices are heard. This also supports my reflexivity, recognizing positionality, addressing power imbalances, and ensuring peer researchers are meaningfully involved and valued. So I'm going to quickly introduce the data set as well that I'm using to explore objective 1. So I'm using the REACH Resilience, Ethnicity and Adolescent Mental Health Study data, which is a unique accelerated cohort study. So this just means that REACH follows 3 overlapping year groups, which gives me a more fine-grained developmental picture across multiple time points. And it has provided an invaluable opportunity to explore how mental health help seeking evolves, particularly in diverse populations. So when I look at the sample characteristics, you can see here that this is, of course, my analysis sample, and this is anyone who has help-seeking data. Participants were drawn from 12 mainstream secondary schools in Lambeth and Southwark. So these are areas with some of the highest ethnic and socio-economic diversity in London. And have higher levels of adult mental health need. So our sample is representative of the local population, as you can see, though girls are slightly overrepresented and boys slightly under, which I'll be working on with my supervisors to restore representativeness. As you can also see, rather than aggregating ethnic categories, I retained disaggregated Black ethnic groupings where possible, which allows me to capture within group variation, where much research tends to just lump all ethnic minority group in one category or lump the Black ethnic minority group in one category, which is, for me, unhelpful when we're looking at racial inequalities. So I'm going to quickly try and go through some of my very, very early emerging findings, early prevalence findings from the data, and just give you a quick overview as there's quite a bit to go through. So when young people were asked about sources of support for emotional difficulties, difficult thoughts, problems, or experiences, you can see in the first section here, where we ask about overall, over half of young people said they had turned to one of the support sources listed in their lifetime. You can also see that the most common source of support was school-based. So this is just where young people were asked about whether they sought support from teachers or SEN staff in school. And yeah, you can see that this is the second most common use support source. And you can also see that internet is closely follows in school support, but professional mental health services were used much less frequently, as we can see here, lifetime and in the past year. So while school emerges as a key source of support, I want to just look more closely at how this varies by ethnicity. So this slide focuses on Black groups in comparison to white British young people in the past year. So you can see across ethnic groups, school-based support remained the most common source of support here. Religious support was notably higher among Black African youth compared to white British young people, at about 13% for Black African young people compared to less than 2% for white British young people. If we have a look back at the graph, GPs, I was quite surprised about this. GPs were commonly used across all groups, with slightly higher prevalence among Black young people. And professional mental health services remained one of the least used sources, especially for Black African young people, as we can see here. So these findings both align with and diverge from existing literature, which often underplays the role of school and community-based support. Of course, like I said, I won't stay on this for too long. I'm also taking an intersectional lens, and this reveals a little bit more nuanced disparities. So I'll just talk about a few that have stood out for me. So Black African boys and those in the Black other category report some of the lowest in-school help seeking rates, an area again where research is sparse. Interestingly, though, white British free school meal eligible young people reported the highest overall help seeking at about 61%. However, the confidence interval here is wide due to smaller sample sizes, so these estimates should be interpreted cautiously. I'm also going to be looking at like gender differences, free school meal eligibility, age, but also mental distress. So I'll go through that quite briefly. So have a brief look at the graph. I don't know what stands out for you all, but as you can see, help seeking increases with higher levels of distress across all groups, with the steepest rises amongst white British groups and Black Caribbean groups. However, let's get this sorted, Black African, mixed white and Black, and other Black groups, the increase is more modest, which could suggest a flatter or more constrained help seeking pattern, even in the growing face of distress. So among those also who reported the highest levels of distress, Black African and Black Caribbean young people were more likely to seek support in school compared to some of their peers, which raises the question about the unique role school plays in their help seeking pathways. So Next steps will include logistic regression analyses to assess how ethnicity, gender, free school meal status, age, and mental distress interact to shape help seeking. And given that school-based support is the most common form of help seeking across ethnic groups, I'll also be exploring school climate-related questions in the data set. So this just includes perceptions of unfair treatment from teachers, experiences of racism in school, feelings of safety to assess whether a negative school environment may hinder help seeking in and outside of school. And I'll talk a bit about how that links with some of the findings from our qualitative interviews. And then to conclude quantitative analysis, I'll be addressing the question, well, what then happened to help seeking during the COVID-19 period? Okay, let's talk a little bit about the qualitative component of my research. So far I've conducted 19 interviews with plans to recruit 1 or 2 more boys. This is proven very difficult. So if anyone has any tips on how to recruit boys, then I greatly appreciate that. Transcription is ongoing and analysis is in the very early stages using thematic analysis with eventual support from a second coder. So, like I said, whilst I'm still in the early stages of analyses, several themes have already begun to emerge. So we can see in theme number 1, it talks about lack of representation and understanding. So this just included things like participants describing feeling pressure to embody cultural ideals of strength, particularly Black women and men, with the perception of Black women as strong, which creates pressure to avoid vulnerability. Black men were often also discouraged from expressing vulnerability due to societal expectations of strength and dominance. Mental health struggles were often dismissed as bad behavior at home or in school. Participants also expressed embarrassment in sharing their mental health struggles due to the cultural expectations of fear of being judged. And then there was a growing discomfort around working with non-Black therapists and mental health professionals. So number 2, family support and religion. So this just covers things like parents often recognizing mental health struggles, but also emphasizing resilience or often avoiding discussing them more deeply. Some families and young people also use religion as a primary coping mechanism, encouraging prayer rather than seeking professional help. Community-based support was seen as favored through qualitative interviews as young people felt more supported and understood within those groups. And then this is one of the key themes that have been emerging through my qualitative interviews. And this is just the role of the school environment. So like I said, a key emerging theme relates to the role of school diversity also in shaping trust and help seeking. So in less diverse schools, I found, or where school experiences were negative, participants described mistrust towards teachers, often due to perceived biases and fears of escalation when seeking help. Some Black students also felt overlooked and felt that the support in school was unequal. While some acknowledged that teachers might care, many recognise that a lot of teachers lack the cultural understanding to fully support Black students. And then in more diverse schools, which I've also found quite interesting, participants actually did feel more comfortable accessing support, particularly when they could turn to a trusted teacher. However, we need to just note this, that oftentimes students would often then try and find somebody from a similar ethnic background, so a teacher from a similar ethnic background, because this kind of shared experience fostered greater trust and a willingness to seek help. So I've got a few quotes to read through, but for me, before I read these quotes from young people, these findings are raising critical questions. Do schools play a critical role in pathways to support for Black young people? Then what are the implications for teachers from minoritized groups? And how can support be improved in less diverse schools and schools in general? These insights will be instrumental in shaping the co-created school toolkit. So I'll just read through some of the
So we're going to have to wrap up fairly soon.
yeah, that's fine. I'm coming to the end. So knowing that I have a teacher that cares about my mental well-being, I think it's a lot to do with specific teachers, those that are kind and care about you. That makes a big difference in trying to reach out for help. When teachers who are a person of color themselves, someone who is from an ethnic background, they would understand me more. When you are being avoided or people being scared of you, it does make you more lonely. That contributes to why it's difficult to be vulnerable. You just overthink too much. When you're trying to ask for help, it won't be taken as serious, because if you're feared or people are scared of you, it's difficult to think now they'd want to hear you out or feel bad for you. There's another one, but we'll leave that one. And then just lastly, before I close, it's always important for me to reflect on any challenges throughout this process. So quickly, as somebody who's comfortable in qualitative research, the quantitative component has been a steep learning curve for me, but there's progress. So last year, if you were in the presentation last year, the stats emoji was sad. This year it's neutral, and next year I'm aiming for a smile. So the components of mixed methods projects, it can be hard to balance the demands of all of the different components. So recruitment, especially like I said, for Black boys and students in less diverse schools has been challenging. And I also anticipate further challenges around missing data and attrition, particularly due to during the COVID waves. And then lastly, participatory research is incredibly rewarding, but it's very time consuming and requires constant reflection and adaptation. These challenges, however, are worth navigating to produce meaningful and inclusive research. I'll just let you read through what's next, and that's the end. Thank you.